Hardly any hemorrhage on the right.
Looks like the flip worked.
How's the heart, Whitaker? Feels full of blood. First time since we started.
Hold compressions.
This is VFib. Please, somebody shock that.
Quivering bag of worms.
Resume compressions.
When the heart quivers like that, it's obvious VFib.
Okay, internal paddles ready.
Charge 2.
25
50 joules. 50 gets it right the first time.
Charge.
Okay, Whitaker, when you're ready.
Clear.
That's what normal sinus looks like.
Strong carotid. Saline lap pads and up to the OR.
Love this. 50 joules gets it right the first time. These are internal defibrillation paddles, and these are sterile, and these are designed to purely perform cardiac defibrillation during a thoracotomy. The amount of joules delivered when we perform this externally in a non-thoracotomy setting, 200 joules, 300, 360, things like that. When we go directly to the heart itself, it's much lower energy, typically 10 to 20 joules. The fact that Dr. Robbie mentions 50 gets it right means he's did this before, because it's not uncommon. You hit him with 20, it's still VFib, you hit him again. And so the fact that he just wants to go hard or go home, right? Hit him with 50 and be done. Totally fine, I get it. I love it.
It's a hell of a way to start the day.
Unconventional, but a decent outcome.
I don't know if I'd say unconventional.
Why don't we split up for efficiency? Residents present to either one of us, but not both.
We can certainly discuss that.
We can discuss that. Dr. Robbie is the main attending today. This attending is on an orientation shift. Regardless of her taking over when Dr. Robbie leaves, this is still his ER. But I do agree that they need a system in place. Otherwise, there's going to be a lot of stepping on toes this entire shift, this entire season. But you know, they definitely need something in place. Otherwise, this is just going to get worse. The amount of friction already between these two is palpable. All right. Now, in some hospitals, in some situations, you actually don't have an orientation shift at all. You hit the ground running. It's you. But we do know this orientation shift actually based on what he said earlier. Something along the lines Dr. Robbie mentioned, you know, he didn't expect her until later, implying she was just going to show up later. A lot of times, even your orientation shift may not be a full shift. It may be a partial shift. One of the hospitals I worked at, I had 2 orientation shifts. Another hospital I worked at, I had 1 orientation shift. Another hospital I was at, it was literally just orientation shift for 2 hours. And the next day, boom, that's you. So this happens. Overall, a few dynamics need to be worked out. Otherwise, this is going to be an entire season. It's just going to be a lot of friction.